Hey nurses and future RNs, ever stared at IV bag and wondering if it's going to hydrate your patient or turn their cells into raisins? Today we are diving into world of IV fluids, isotonic, hypotonic and hypertonic. By the end you will know exactly when to use each one and ace those NCLEX questions. Let's get fluid. I'm your fellow nurse, your go to for nursing hacks and med breakdowns. If you are watching my videos on electrolytes or the sodium potassium pump, this builds right on that. We will break down the three type of fluids, their effect on cells, and common examples, and key nursing tips. Stick around for a quick quiz at the end to test your knowledge. Hit that like button if you're ready. First, let's talk about tonicity. It's all about osmosis, that water movement across cell membranes. Imagine cells as balloons. Too much water, they swell. Too little, they shrink. Tonicity compares the fluid's solute concentration to your patient's blood plasma, around 280 to 300 milliosmoles per liter. Starting with isotonic fluids, these match your body's concentration. So, no big water shifts, cells stay happy and balanced. Example is normal saline that we usually use 0.9% NaCl, your everyday hero for fluid replacement. Lactate ringers with electrolytes like potassium and calcium, greater for surgery or burns when we have to replace electrolytes. D5W, which is 5% dextrose in water, starts isotonic but turns hypotonic once the sugar metabolized. The use of isotonic fluid is to dehydration from vomiting, blood loss, or just maintaining volume. Nursing tip here, monitor for overload in heart failure patients. Watch those lungs for crackles. For NCLEX, if a question asks for a fluid that wouldn't mess with cell size, go for isotonic. Hypotonic. So, hypotonic fluids lower concentration than blood, so water rushes into cells, making them swell. The example would be 0.45% NaCl, half normal saline for cellular hydration, 0.33 NaCl, even more diluted, and plain D5W after metabolism. The use of this fluid would be hyponatremia or diabetic ketoacidosis, where cells need intracellular water. We have to avoid in hyponatremia or brain injury because it could cause cerebral edema. It will flow into brain and will cause it will cross the brain membrane. The nursing tip here, access sodium levels first and infuse slowly. If your patient gets headache, stop and notify your provider. And finally, our hypertonic fluid, it has higher concentration, pulling water out of cells into the bloodstream, and then cells shrink, which can be life-saving. Example would be 3% or 5% NaCl for severe hyponatremia. D5NS, dextrose in normal saline, combines sugar and salt, and mannitol for reducing brain swelling. Whenever you get a question about cerebral edema, we usually go for mannitol. And the uses are cerebral edema, shock, pulling fluid from tissues, administer via central line to avoid vein damage. The NCLEX tip here, we have to monitor electrolyte hourly and watch for dehydration signs like dry mouth. These are for emergencies. Think pulling fluid into veins fast. In case of shock, in case of cerebral edema, because we cannot wait in those cases. It will cause intracranial pressure rise and brain herniation. So we have to act fast on those cases. Okay, let's go for quiz. What's the go-to for blood loss? It's isotonic. For brain swelling, it's hypertonic. So summing up, isotonic balances, hypotonic hydrates cells, and hypertonic reduce swelling. Choose based on your patient's labs and conditions. Always double check your orders and monitor vitals. Fluids can save lives or cause harm. If this cleared up fluids for you, drop a comment with your toughest NCLEX fluid question. Like, subscribe for more nursing must knows, and hit the bell.